Welcome, everybody who's here with me today. I want to thank you for spending part of your day with me. And just a little about who I am and what I've done. I'm Liz Lundry. I have been a hygienist since 1979. And before that, I was actually an assistant for my orthodontist. So I was an orthodontic assistant right out of high school and realized right away that I really thought this dental thing was pretty cool. I just really wanted to get in people's mouths with the mirror and just that was so awesome. So it was a great opportunity and became a hygienist and, worked clinical for just about going on 40 years. And I also have been a trainer with the JP Institute. So I have been doing that over the last 30 years. And with that, I just wanted to share what the JP Institute is. We provide ADACE going into practices to really help elevate them to another level of excellence. And we've actually been teaching and talking about the oral systemic link since the 1980s. So the founder of JP, Jan Lazarus, who was a hygienist, really understood, and we saw as clinicians, which I know you've always seen this too, how different people heal differently, how we need to look at other aspects of their lives. We're so focused on the mouth, but that's connected to the rest of them. So people heal differently depending on their genetics, their lifestyle, their diets, the quality of their sleep. So I think all of us are seeing more and more of the need to put all of that together, which is why you're here, so you can learn about Dentamedica and probiotics. So our mission at Stella Life, I've been with Stella Life for, pretty much since the beginning. So I am the clinical educator for Stella Life and also a product specialist. But our mission at Stella Life, like yours, is to improve lives and to save lives. So every time that you are treating a patient for periodontal disease, of course, you're saving their lives. And as you're replacing failing restorations that are beautiful environments for biofilm, for pathogenic bacteria to grow, when you replace those, you are saving patients' lives. It's definitely extending them. So at Stella Life, we share that same mission. And with Stella Life, we're able to improve lives by accelerating healing, relieving pain, and reducing the need for opioids. So as I learned about Stella Life, learning that it was all natural, and that was always what I looked for in my own life and with my family, it was a natural fit for me. And I'm passionate about having a product that is not toxic, that really is not going to do our microbiomes any harm. In fact, it just does us good. And we've got hundreds of thousands of patients at this point and thousands of clinicians who have this in their practices. And we are also involved, and have been a member for many years of the American Academy for Oral and Systemic Health, AOSH. So again, this is an organization of dentists, hygienists, myofunctional therapists, physicians, naturopaths, chiropractors, nutritionists, everybody that we need, because it really takes a village to take care of our patients. So to have, for example, physicians in your area that understand and appreciate that oral systemic link and how the mouth is not just a separate entity, how we really need to look at it all together. And when you have those types of people in your environment, then, we can refer to each other and really take care of our patients' entire, all their total needs to really be truly healthy, because we do need to work together as a team. So Stella Life has been a part of AOSH for a long time, and we are now also a part of Apollo Health. So Apollo Health is an organization that was started by Dr. Dale Beredesen. Dr. Beredesen is a neuroscientist, and he has written 4 books. His first one was a New York Times bestseller. It's called The End of Alzheimer's. And he has a protocol called RECODE, where he actually reverses dementia. And he gets success rates up at like the 98th percentile of being able to reverse dementia, no matter to what degree it has developed. And he also has a protocol for preventing it. This disease is completely preventable and completely treatable. And you, as dentists, can also become Apollo Health providers. So we are part of his protocol because two of the primary pathogens that are linked with dementia, P. gingivalis and fusonucleatum, these two, again, primary causes, as there are actually 36 aspects of dementia, and he kind of treats them one by one with this protocol. And this is how we're able to get patients whole again, or at least much better improved. So, the quality of life really goes up for these patients. But Stella Life Rinse actually does kill these pathogens and actually keeps them inactivated for varying lengths of time, depending on the pathogen, but it does not destroy the microbiome. So we have our rinses, and our oral probiotics lozenges are now part of that Apollo protocol. So we're very proud and honored to be part of that. Again, saving lives. And we have so many doctors who use Stella Life, and so many doctors who teach courses who share the benefits of Stella Life with their attendees, because they've seen happier patients, how it really builds your practice, and how we're able just to see so much better healing and have solutions for conditions that we've never really had solutions for in the past. So today, I'm going to be focusing on our Stella Life probiotics and Stella Life Dentamedica, and how you can incorporate this into your procedures, into your practice, into your business, and how this is a benefit for your business, how you can really elevate your practice and help with your practice growth. So let me just have a sip here. Very specifically, we're going to talk about how vitamin D affects bone healing and immunity, and what the issues are, the risks of deficiency, particularly with implant and perio surgery, and how when people are deficient, it does have an effect on the level of healing that they can achieve. So I'll be sharing some research for you, and also talk about how these work, what they do, and how you can apply this in your practice. So with all of our products and with the Dentamedica and the probiotics, we can use these in every aspect of dentistry. So our patients, all being human beings, they need good nutrition. Do we get that? Probably not, right? So this is an issue, and this is why we have so many issues with patients with deficiencies. And then again, we're learning more and more about that microbiome, not just in the mouth, but in the gut, and how that affects our healing and affects so many other aspects of our lives. This is an emerging field of research, and it's very, very exciting. So as I mentioned earlier about our Stella Life rinse, I just wanted to share the study as I was talking about Dr. Bredesen and the Apollo protocol. In the study, they found that the Stella Life rinse inhibited the growth of fusonucleatum, so FN, for 12 hours after exposure, and P. gingivalis for 120 hours after exposure. So with that bacteriostatic activity, we see that we're able to keep these key pathogens, particularly P. gingivalis, which is a keystone pathogen, linked with many diseases of the body, 57 to be, well, we know so far, and in many conditions such as erectile dysfunction. And as I always say, nobody wants that. So as it's able to be effective against these pathogens and others, it has a lower toxicity toward the commensal bacteria. And so we're able to preserve that, because again, we need to have a balanced oral microbiome. And as I talk about this today, when we talk about the probiotics, we can see how we can really manage that and just not have a place for those pathogenic bacteria to take hold. So we're so excited about that, as well as the fact that when you compare the Stella Life rinse to other chemical rinses, we still have great anti-biofilm activity and can disrupt biofilm. So with our pre and post probiotics, what is it? We are actually the only company that has both the oral lozenges and the gut probiotics in one box, so that we're able to maintain, because our mouth, of course, our digestive system, our gut, it's all connected. So working really on both ends, we're able to restore a healthy mouth and a gut. So with the probiotics, have 7 pre and post probiotic strains. And with the lozenge, it has a direct effect on oral health. We also include vitamin C and D and zinc. And the gut capsules are a spore strain. So that means that you don't need to keep it refrigerated, and it does survive the stomach acid to get to the gut to do what it's supposed to do. So also, as we look at different probiotics, they can be pretty pricey. So these have actually been kept to be very, very affordable for our patients. And the oral lozenge is available as a standalone product as well. So we now have a 60 count box as well as a 30 count. So we're able to have this for our patients and use it ourselves so we can really have that balanced oral and gut microbiome. So the strains that we have included, we're the only company that has all of these different strains. And as you can see, they have very specific effect on different aspects of healing and give us many benefits. So again, by getting that healthy balance in the mouth, we're able to really defend ourselves against periodontal disease. We get rid of those stinky bacteria and we can replenish it with nice commensal bacteria for patients that may have bad breath. You see this staining of teeth in children, these strange colors. So, with this salivarius strain, we're able to, again, keep that balance so we don't have these bacteria that have other issues. And helps with the immune system. The lactobacillus casei actually helps us to reduce the strep mutans activity, so reducing caries risk, and it has antifungal properties. And just as a sidebar, I read a really interesting article recently that was in the BBC and in my BBC feed, and they talked about how lactobacillus casei and also Lactobacillus rhamnosus, who's also, these are all within our strains that we include. They actually are beneficial for sleep. And they've done studies showing that people that have these actually have enhanced sleep. Now, this is not part of the research that I'm covering, with Stell Life specifically, but I thought this was really interesting. Again, this is an emerging field, and we're learning new things about these incredible bacteria every day. And, we haven't respected them because we've been trying to kill all of them. And between rinses, chemical rinses that we use, as well as antibiotics. And now we're seeing that this really affects our own health, very, very negatively. So again, with these different strains, we're able to reduce mucositis, help to reduce the biofilm, the harmful bacteria. We have antifungal properties. With the Rutary, we also are able to, really have a better effect of managing PG, the killer. That bacteria, P. gingivalis, actually has the ability to change the genetic expression of commensal bacteria so it can turn those bacteria into pathogens. So as you know, it's a keystone pathogen. It's kind of like the gang leader. So it's the leader of the bad guys, right? And really orchestrates what they do and where they're going to grow, and gives them chemical signals through quorum gene sensing regulation. So it tells these other bacteria where they're supposed to go and what they need to do. So if we can really keep control of this one bug, this is how we're able to keep control of these other bacteria as well, because they grow in a biofilm colony. They're very organized. They have waterways, nutrient canals, they're called. They set up plumbing, and they have a very effective protective layer. And that protective layer, mucopolysaccharide matrix, makes this biofilm colony really very difficult to disrupt without using, the right technology, and then using products that are going to keep these bacteria under control. So with these strains, we're able to see so many different benefits. And, we've been destroying these good bacteria together with the bad by using the antiseptic rinses that we've always used, again, like chlorhexidine, like other over-the-counter mouth washes. So our mission has been, we got to kill everything. And what we're learning is that we really don't. We want to preserve that balance. And we do sometimes need to use antibiotics, of course. We're saving lives and helping people to stay healthy and infection-free with these antibiotics, but that comes with a price, because when we use any systemic antibiotics, we know it takes the gut bacteria about 4 to 6 months for it to get back to normal. So if we're going to be giving a patient antibiotics, then it really makes total sense to give them the probiotics, the Style Life probiotics kit, so we can help support them and not have such a long lag time before their gut is back where it's supposed to be. Again, some of when we have dysbiosis of the gut, that type of imbalance is actually linked to eczema, to different skin conditions, as well as depression. So again, so many different things that happen when you don't have a nice varied and not dysbiosis. You want to have a nice balance of that microbiome in the gut, in the mouth, and on your whole body. So there are a lot of new products out there that help to actually promote probiotics on the skin. You've probably seen skincare products and creams and hair products with that, because these bacteria live everywhere and we need to take really good care of them. So here in this study, they looked at this patient who presented. This is a case study, and you can see this in a lot of research on our stellalife.com page. If you go to the professionals tab and then go to the research tab, you can see many, many studies, some of which I'll be talking about and have already discussed. So you can see this case. So this patient presented with 4 to 6 millimeter pockets and generalized bleeding. And when you look at the study, you can also see the perio chart for this patient. So what they did with this patient is they just put her on the Stella Life the probiotics kit with the gut lozenge and the oral lozenges. So they didn't use any other Stella Life oral care products. And as they put the patient on this kit, then they did SRPs. So of course, you see the image here, 6 weeks after the scaling and the root planing, she looks pretty good. Well, as a hygienist, they all look good 6 weeks after we do scaling and root planing, right? Regardless of what you may give them. But when you look at the study after 4 months, as we look at the charting, you see that it's really improved so much. So initially, we are seeing pockets between, up to 4 to 6 millimeters with generalized bleeding. And after 4 months of continuing to use the probiotics kit, everything just got better and better. So she had just a couple of fours, just a couple of bleeding points, and the rest of the pockets were twos and threes. So again, this is evidence of the fact that if we can promote, a healthy oral microbiome with these commensal bacteria, the pathogenic bacteria simply don't have a parking spot. And if there's no place that they can latch on, as you learned when you took microbiology, they can't proliferate. So this is the best defense that we have, which is a natural defense. And you can eliminate these pathogens through our therapeutic procedures that we do, using our Style Life rinses to safely disinfect. But then we can build this healthy microbiome with the right probiotics. And when we do that, again, there is no way that in most cases, of course, people's immune systems are different. That's why we need to see them frequently, keep our patients on a pretty good, I always recommend about 12 weeks between maintenance appointments, particularly with patients who've been diagnosed with periodontal disease and treated for that. So again, it's a matter of monitoring that bacteria and really keeping control of that oral balance. So with our probiotics kit, the patients would take the gut capsule once a day with water. They can do that any time of the day. And they would use the lozenge, take that once a day, allowing 5 minutes for that to dissolve in the mouth. And it should not be chewed. And the patient should not rinse with any disinfected rinses, including Stella Life, for 2 hours before or 2 hours afterwards. And then after the lozenge has dissolved, they should not eat or drink for 20 minutes after that. So like all of our oral care products, the lozenge is a delicious strawberry flavor, and you just only should have one. Okay, don't have more than one a day. And you can do this together if it's convenient, whatever works for your schedule. But this is what we would have our patients do. So, really important, again, especially if we're giving them any antibiotics. So, as we're talking about the oral microbiome and the bacteria, I always like to ask if any of you are doing saliva testing in your practice. When Oral DNA first opened their doors years and years ago, they asked the JP Institute to help educate the dental community about salivary diagnostics. And Laura Hooper is an incredible hygienist. She's so smart and she does nothing but research and she lectures. And we have a number of her videos actually on our website. If you go to the education page, you'll be able to see a lot of presentations there, including some of hers. So she is with Simply Perio, but she has worked with other companies in the past and is truly an expert and has a great understanding of, the oral microbiome. And honestly, if we're not testing, we really don't know what's going on. I often, when I do an in-depth presentation on saliva testing and the oral microbiome, I present my own case and an image of my teeth where I have no bleeding, the tissue looks perfect. And yet, when I had my first saliva test done, I had Tenorella present. And that is attached to actually part attachment loss, which I have for a variety of reasons, but that bug just didn't help. But if you looked at my mouth, the probing, all of that, no bleeding, shallow pocketing, looks pretty healthy. And I actually did an interview with Dr. Tom Neighbors, who was the founder of Oral DNA Labs. And you can see that podcast on the Still Life Innovator series over on YouTube, on our YouTube channel. But with that, he talks about how we've been using a perio probe which was developed in 1936. So if we're not using saliva testing, we're using 1936 technology to diagnose periodontal disease. And then once we treat them, do we know if they're really healthy? With any type of infection anywhere else in the world of medicine, you're going to test to see what bacteria is causing that infection and whether or not you may need antibiotics. I'm sure patients ask you sometimes when you tell them, you have an infection, you have periodontal disease. They say, well, if I have an infection, why don't you give me some antibiotics? I've had that question many times. And sometimes we can't, but we need to know why and what to give to our patients. So check these videos out. They're just really informative, and she's a wonderful speaker. So these are some of her charts from her saliva hacker that she provides for us. You can see these as well. So as we look at the different bacteria and what the recommendations are, for treating this, whether or not they should get any antibiotics, and of course, how often they should be tested, whether they have a positive or negative test, and also the use of probiotics is recommended. So as she breaks it down to the red complex, orange, these other bacteria, in these different groups, you can see what the pre-treatment and the post-treatment includes. And you can see that Stellalife is actually recommended for these different conditions, these varying conditions with these different pathogens, again, because of the bacteriostatic, that bactericidal activity, but in fact, that it actually promotes a healthy oral microbiome. So there are a lot of companies out there. These are just a few. There's Oral Vital in Canada. We have companies all over the US that provide different levels of testing. They test for different things. So please check them out. Simply Perio is awesome, as is Oral DNA Labs. So we are able to test not just for the pathogens, but for other bacteria, including commensals with some of these, like in bristle. So yeah, check them out and implement that into your offices, because again, without that, we're only just guessing as to what is really going on in our patients' mouths. So with looking at overall health, we've always heard that saying, you are what you eat, and we truly see that in our world. When we see patients that really have poor nutrition or they're eating a lot of junk foods, drinking, a lot of sodas, things like that, we see they don't have the same level of health as the patients who take better care of themselves. And there's an amazing book by Dr. Weston Price. It's called Nutrition and Physical Degeneration. And it was actually published in the 1930s. And Dr. Price was a dentist. He traveled the world with his wife, who was a nurse, and they studied isolated cultures in, the islands in Australia, Africa, different parts of the world. And they found that when these groups only ate the natural foods that were in their environment, which included a lot of prebiotics, because they, eat roots and root vegetables, which we often don't have very much of in our diet. But as they're able to consume what was there locally, these patients, and you can see pictures that he took all over the world of these groups of people, they have perfect teeth. They had no periodontal disease. They had no caries, and their teeth were straight and beautiful. And then once they were introduced to Western foods, namely processed sugars, the very next generation, because they followed up and went back to these groups later and took more pictures. But you can see that their children, after being exposed to these other foods, now did have periodontal disease, as did their parents, because they started eating these foods, they started to get cavities, but the kids actually started to exhibit malocclusion. And we've always thought that's because, genetics, small jaw, big teeth, that's why they have this problem crowding. Well, as it turns out, the evidence was there. It's because of the nutrition. And because we don't have great nutrition, we need to really help our patients, because try as we might, we don't live the lifestyle that we really should to be totally healthy. So this is why we have Dentomedica. So this is a way to help our patients heal, and actually to prep them if they're having any surgeries that involve bone. Because we want to make sure they have all of the nutrients needed for healing, the antioxidants, all the vitamins, but we really want to make sure that they have the vitamin D. So, or there's a lot of research on this. You can Google it. You can look at these studies. But as we look at these different the research projects that are out there, we know that if the patient is deficient in D, we're not going to get very good osseointegration, and it's going to lead to implant failure. So with that, you can check these articles out. I kind of did a little bit of an overview of some of these to just bring you some key points. And so based on the research, we know that vitamin D deficiency has been observed in over 70% of the population. Now, I live in beautiful, sunny California. I grew up in Miami, so I've been blessed with living in sunny places all my life. I did spend 3 years in England, where it's not always so sunny. But even if we live in these beautiful, sunny places, we don't get enough sunshine. We're indoors, we're doing our jobs, we're in school, so we're not spending enough time outside. So we're not getting the sunlight that we need. And then when it comes to our diets, we're not getting what we need either. If we're eating a lot of packaged foods, if we're eating frozen foods, for one thing, they have zero probiotics. So we're completely not getting that from our diet. You really need to eat fruits and vegetables and fresh foods, not processed foods. Also, the presence of vitamins, the amount that is available through these processed foods is practically non-existent. And even if you're eating all of the right foods, we live in a very polluted environment. So there have been so many studies that have shown how just the regular old everyday air pollution has an impact on patients' health, and we see correlation to asthma, so all these other conditions. So we are exposed to so many toxins in our environment, and our food isn't always clean either. So taking supplements is something I've always believed in based on the research I've done since the 1970s, and I have been taking supplements since then. But we do see that our patients are not leading a good lifestyle and are definitely deficient. Links with smoking and generalized periodontitis are also associated with a 200% increase in dental implant failure, but vitamin C deficiency is associated with up to a 300% implant failure. Also, a deficiency in D is linked with depression, dementia, Alzheimer's, asthma, cardiovascular diseases, and diabetes, among others. Again, these are all inflammatory diseases, and we will have. You can eat anti-inflammatory foods, but most of us are eating inflammatory foods. Even like a lot of cheese causes inflammation, so it's a matter of having that balance. And we need antioxidants. So these are available in fruits and vegetables. And also, another great source of antioxidants are the yolks of eggs. You have a lot of great antioxidants which help to reduce oxidative stress. When you have oxidative stress, ultimately what happens is that your DNA starts replicating with errors. So this is why the antioxidants are really, really important. And we need to eat a variety of different foods, all the different colors, the vegetables and fruits to get all of these different antioxidants. And of course, that can be challenging. And getting back to the egg yolks, that's like some of the most nutritious part of the egg. But because of this cholesterol thing, which now we're learning on the current research isn't really what's going on with cardiovascular disease, we've been getting rid of them and making white egg omelets. So we're actually throwing out some of the most nutritious part of the egg. So eat your yolks, eat the whole thing, eat a lot of whole foods. So the B complex, the carotenoids, all these minerals as well, we need to have these present in a consistent supply so that we can help our patients heal from surgeries, whether or not they're including bone, but if we're doing a scaling and root planing on our patients, anything that involves tissue, and even just for them to have healthy gingiva, they need to have all of these elements here. So this is a chart from one of the studies that I showed you earlier that shows what the normal levels of D in the blood should be and where they're deficient. And this comes into play as we are learning, what vitamin D levels our patients have. And this is critical information. So I'm going to talk about means of doing that. So that information is out there for you. And here's one of these cool charts, that shows what vitamin D does, how you get it from the sun, we get it from foods, and how there are a series of biochemical reactions with which it's involved because it also acts as a hormone, enabling the absorption, of other minerals and other vitamins. So you really need, again, to have that balance. So with that, our Dentamedica supplements are amazing and they're unique. As I mentioned to you, I've been taking supplements since the 1970s when I first learned about Linus Pauling and vitamin C and all of the other nutrients that we need. I really had a very high interest in that. So what I'm so excited about with Dentamedica is it really has everything that you need. And all of our products, our Stelli products, are made in a facility that is got the GMP seal, meaning good manufacturing practices. So what that means is that the FDA oversees all of our products and they are all tested. So they're tested for purity, tested to be effective. And Dentamedica actually has also been tested for absorption. And we know that the vitamin D is absorbed because we have the results of blood work done with patients before and after. We also know that the antioxidants are being absorbed using a biophotonic scanner. So we know that you have, because it's a GMP certified facility, what you see on the box is actually in the capsule because in the US, there's really not much regulation on vitamins. So you really don't know what you're getting. So any supplements you're taking, I've gone through all of my things that I take, which I also take Dentamedica now, of course, but the other supplements that I take for sleep or whatever, and I make sure that everything is GMP certified. So these are made in the US, non-GMO. It's a vegan formula and it is gluten-free, so safe for everybody to use. It's also a very clean formula. So we're needing this for, our entire bodies. This provides us the D we need for our bones, the antioxidants, the essential vitamins and minerals, and all the benefits that we get from that. Again, even if you're eating a lot of really good foods, I think because we're living in such a toxic environment with the air, the water, the plastics, all of that we're dealing with every day, I think it really helps, to have that secure powerhouse of all the vitamins and nutrients to keep us healthy. So as we look at other supplements, with comparing to Stella Life, our vitamin D is actually derived from lichens. So a lichen is a plant. It's plant-based, and because it's derived from lichen, it's better absorbed. Most vitamin D is derived from sheep's wool, so it's an animal-based product. I was quite surprised when I heard that. But again, having a plant-based product, you're going to get this better absorption, and again, it's very clean. Our K2, if you I know that my mom is almost 90, and I was going through her supplements, and she was taking a vitamin D supplement that had no K in it at all, no K2. So without the K2, the vitamin D is not going to get absorbed. So she's now on Dentamedica. But in any case, with the K2, ours is derived from chickpeas, where usually it's derived from soybeans, and many people are allergic to soy. So we want to make sure there are no allergens in this formula, which there aren't. Our B9 and B12 are methylated. There are many people who have a mutation, so the gene that methylates the B vitamins is just not there. They have that mutation, so they can't methylate the Bs. So without that ability, they're not able to actually absorb the B. So you can pay extra if you buy B vitamins that are already methylated, but our B are already methylated, so you don't have to worry about that. So again, most formulas are not. With our calcium citrate, it is better absorbed than the calcium carbonate that you normally see. And we don't have any magnesium stearate in our product. So magnesium stearate is a chemical that is used to lubricate the capsules as they go through the machinery in the factory where it's manufactured. And it's toxic to a lot of people. So again, our formula is very clean. We don't have these chemicals. Everything, again, is monitored by the FDA. Again, no allergens, and it is made in the US. So what's important to do with your patients before they're going to be getting an implant is you need to know if they're deficient. Now, given all of the research, we know that they probably are, but you can get blood work requested through their physician. I know that when patients are going to be going to have heart surgery, they ask us to give them a clean bill of dental health. And now we can get some help from our physicians. I think it's going to help to get them to understand this connection and what we can really do to keep our patients healthy together. So it's a great way to build relationships that way too. But we can find out if the patients are deficient or not, because if they're not, we don't want to be overloading them with the D. It is a fat-soluble vitamin after all. So assuming that the patients are deficient, you can also do chairside testing, which I'll talk about in a bit. But if they're scheduled for an implant, we want them to start taking the Dentamedica. So this one bottle of Dentamedica is a 6-week course. And so ideally, they would start taking it 4 weeks before the implant or the bone surgery is done. Anything that involves bone grafting, any of that. And then for 2 weeks after. Now, nobody wants to wait 4 weeks before getting an implant placed. And Dr. Rick Myron, who is behind the development of Dentamedica, who's a periodontist, has said that you can do 2 weeks before and then 4 weeks after. But I think that we need to look at the total patient. We have to look at all of their risk factors. And then for some patients, maybe it's better to, follow that protocol. And in fact, if you have a high-risk patient, if they're smokers, they have issues with their healing, have some type of an autoimmune condition, then they should do a 12-week course, which would be two bottles of Dentamedica, and they would use it 8 weeks before and 4 weeks after. So again, we have to look at each person as an individual. And again, testing is a great idea so we know what's going on with that patient. So if they're taking the loading dose, they would take 2 capsules with a morning meal and they take 2 capsules with an evening meal. So it's better to take it with food because you can avoid possible tummy upset, taking it on an empty stomach, but also you're going to get better absorption if you take it with a meal. So if they are deficient in D, they take 2 capsules in the morning, 2 capsules in the evening. So they continue that regimen until the dentamedica is finished. They have their surgery, and you'll see that you'll be getting better clinical results. Now, we get our D where it's supposed to be. We get our patients to get their D to the optimal level, and then we go back to our evil ways. We don't get enough sunshine. We don't eat the right foods. We're not eating all the fish that we should be eating, like the salmon, the anchovies, sardines. These are herring. These are the kind of fish where you get a good supply of vitamin D. And a lot of people don't include that in their diet. So this is where you can use Dentamedica as a daily supplement, taking it at half the dose. So that would be 1 capsule in the morning, 1 capsule in the evening. So then you can keep that blood level of D and all the other antioxidants and nutrients that protect us from, damage to our DNA, reduce our inflammation. So many benefits to taking a really good clean supplement like Dentamedica. So I know we've been talking for a long time about the use of Stella Life overall. How long do you use it? So we believe in Stella Life for life because you want to live healthy, you want to live long, and definitely with supplements and probiotics, we want to keep that nutritional balance as well as the balance of the good bacteria in our bodies. So if chairside testing is something that you're interested in, there are a lot of different test kits out there. I personally have done some research into them and have learned that many of them are really not very accurate. So this company, if you go to our stellalife.com, go to the Dentamedica page, you can see information and where you can order these kits for your own office. So it does include a pinprick to get some of the blood. You put some reagents in there, and within 10 minutes, you have the result of the patient's vitamin D levels. It seems to be the most accurate of the chairside tests that are out there. Again, just like with supplements, there's not a lot of regulation on these other test kits, and there seems to be a lot of variation on their accuracy. So again, you can just, if you don't want to test chairside, then you could just use the services of the patient's physician and get some labs done. So I just want to share this quick video from one of our Stella Life doctors, periodontist Dr. Jochen Peszak, as he talks about his dentamedic experience.
Hi, I'm Johann Peschak. I'm a periodontist in Monterey, Sunnyvale, California. I had experience with a patient with unexplained two failed implants, no major medical issues. And the third attempt, the patient was tested for vitamin D deficiency. And so that was confirmed. And without further interventions, we put the patient on Dentamedica for 6 weeks. And the third attempt, the implant took no problem. And I'm not sure if the vitamin D deficiency was the ultimate cause of the previous failures, but clinically, the clinical outcome was perfect using the Dentamedica.
Yeah, so again, everybody heals differently. And Dr. Peszak is saying, well, the only variable that changed from the first two failures and then the successful integration of that implant was their D was up where it was supposed to be. So with being able to do that for our patients and really help them stay in good health, I think this is what gives us the most satisfaction as clinicians. But what does Stella Life do for us and for our practice? It does absolutely increase profitability. The profitability comes from you having the professional pricing. There's a 30% margin on that. So you always get that 30% off when you buy by the case. But as you heard from Dr. Peszak, and what all of us who've been using Stella Life as clinicians have found is we get better clinical outcomes. When we use our rinses, our recovery kit with surgeries, We find that patients heal very, very quickly. The rinses increase fibroblast growth. So, with surgical procedures, we generally see a month's worth of healing within a week with less pain and discomfort. As I talked about at the beginning of this presentation, improving lives, reducing opioids. So, with the Dentamedica and the probiotics, we'll be able to get better outcomes for any surgeries that we do, and also being able to help keep our patients in remission longer from periodontal disease. It's considered a disease without a cure, but it's not a disease without a cause, right? So if we can get to the root cause, which of course it's not just the bacteria, it's the patient's immune system, it's the patient's genetics, it's their nutrition. We can help assist, with our Dentamedica with that, again, to use the total oral systemic approach to treating our patients. And when your patients have a great experience because they have less pain, you're giving them products that taste really good, that work really well, their digestion gets better, they don't have bad breath anymore with these products, they feel stronger because they're more nutritionally supported, they're happy. They stay with you. So you retain patients better, and you have those patients that want to tell everybody about how wonderful you are because they love you even more as you see they understand the care, the full care that you're giving them. So in our practices, we do see more referrals. And we also want to help you with that profitability, and we do offer other services to help you with that. But when we look at how you can very easily increase profitability, and again, we do this not because of money, we do this because we want to help our patients. But if we can be more profitable, then we can get more advanced equipment. We can get air polishers for maintaining implants. We can take more courses and take that knowledge to our patients so we can be better clinicians and enjoy what we do more. And there's nothing wrong in taking a little break of a vacation either. We recharge ourselves and we come back ready to go and really help our patients. So just by adding in a very typical for doctors that are doing surgeries to have the recovery kit, the probiotics, and the Dentamedica as a bundle, and you just factor it into the protocol. So with the recovery kit, you would tell the patients this is going to help you heal quicker, and you're going to be more comfortable after the procedure. We're going to be giving you the Dentamedica because we want to make sure you have really good integration with the implant. And we find that with being generally most people are low in D, or if you know this patient's low in D, you explain this is why we're giving this to you, and also explain the benefits of the probiotics. So you just make that as part of the package and just give them one fee. As a longtime consultant and trainer, this is what I recommend, rather than saying, oh, they're going to pay 80% of 4 appointments of scaling and root planing, but they won't pay for your laser, they won't pay for the irrigation. So then what do they do? Say, well, I don't want that. But if you give it a package and say, this is how we provide treatment, this is what we provide you when you have your surgery. Yeah, the recovery kit is also great for SRP patients who are diabetic, who are heavy bleeders or sensitive, so they can get this package to really ensure they have the best healing, and then we'll have the best long-term results. So again, to support your practice, we also put you on our website as a provider, and we give you Intellibly. This is an app that you would normally pay for. And when you have that, like you see this doctor here, has actually got the app going. So when patients find Dr. Weiss, they can click on this tab, and then the office will get the patient's contact information and when they'd like to come in. So again, as I go out in the world and I meet with doctors at different events and talk to my Stella Life doctors, I hear from many of them, we get all these random people calling us to see if they can come to our office and buy Stella Life. So they come into your office, they meet your amazing team, and if you can get a few new patients from Stella Life, which we're seeing is happening, we're very, very happy to do that. So we can help with your business growth, as well as with your clinical success. So with that, I just want to know if we have any questions. I do want to also mention, as you're maybe considering having Stella products, if you don't already, all our products are guaranteed, which means if you buy a case of anything and decide it's not for you, we'll buy it back. And we also will replace a product if a patient is not happy with something, then please give them a refund. Let us know. We'll replace the product for you. And we even will replace expired products. And I don't know of any other company that does that, but we don't want you to be nervous about getting a case of something that you're afraid you're going to get stuck with. We help you, we'll provide training and make sure that you can be successful. So, any questions there?
Thank you, Liz. There were a few questions, but you actually answered them all as you were presenting. It
Okay.
looks like there might be one more that came up. So this was very informative and new. Thank you so much. I'm going to look into the testing kits that you recommended, but how do you recommend someone to build the multivitamins into a practice? What are the steps you would recommend?
So I think that what really is helpful, and you may consider starting even with your intake forms with your patients. So maybe asking them when the last time was that they had their vitamin D level checked. When was the last time they saw their physician? Which you probably already have that, but you can talk about more specific things. And as you welcome new patients into your practice, you can talk about this connection that we know based on the most current research about oral health and how it's connected to body health, and asking them more detailed questions about their health, and also finding about risk factors that they may have acquired genetically from their parents or grandparents. And building on that information, you can then share what's going to be best for them. So, for example, with the supplements, it'll be pretty easy to find out from testing if they are deficient in the D or not. But it's just a matter of making the systemic link part of your conversation and your education with your patients. So it's easy to do something new with your new patients, right? What about the patients you've been seeing for 10, 20, 30 years or more? So with the JP Institute, we always say when patients come in to see the hygienist or the doctor, you can say, you may notice that we're doing some things differently, because we always keep up with the research and we've learned more, from the latest scientific studies of how your body health is affected by the health of your mouth. And once you say that, you can implement anything that you want. But I just urge everybody to have that conversation about the link to body health with the oral health.
Fantastic. Thanks, Liz. One of the questions that did come up that you already answered was, do you offer training? And I think this is a good opportunity to share, what does training look like when someone decides to bring any of the Stella Life products on board?
Yeah, that's a great question. And really to go into the detail of it, as you begin using Stella Life, you really want to know what to do, because there are so many applications. The rinses don't just replace chlorhexidine, but they can be used to treat the symptoms of lichen planus. Lichen planus. They're great for patients with xerostomia, any type of mucositis. When cancer patients use these products, they don't get the mucositis and the mouth sores they normally do. And if they're getting radiation to the head or neck, they don't have to be intubated, because what happens is people just stop swallowing because it is so painful. And we have so many experiences, if you go to our website, of oncology patients who say because of Stella Life, they could keep swallowing. Because when you stop swallowing, your body forgets how to do it. So we go over all of these different applications, and definitely with all of, as you start using Stella Life, we provide that training. If you want to learn more about Stella Life before you start using it, then we can do the same training for the entire team. And again, as a long-time consultant, when we do trainings, we want the whole team to be there, because patients ask everybody questions. So they'll ask on their way out, to, the receptionist, oh, what do I do with this recovery kit again? So everybody needs to be comfortable with it too, so that everybody understands how wonderful these are to offer their patients. Usually everybody kind of starts using the products themselves because they see those benefits. But the training, it goes over all of the products, and it's customized in the sense that if you're a surgeon, if you are a general dentist, if you're a cosmetic dentist, it's going to be adapted to you. But we're going to share all of the science, all of the different applications, and also be able to answer everybody's questions. So it takes about 45 to 50 minutes to do that. We often do it over lunchtime with an office, or with during a team meeting. And we do send complimentary products and support materials when you schedule that training. So we're happy to do that.
Liz, before we move on to the next question, can you expand a little bit about that support material? What, when someone brings these products in, do they get along with the products when they're delivered?
Well, they get a whole package. So we actually have laminate handouts with what procedures need which types of products. So what other also like charts that show what you would need from the product line for different conditions. So we have these laminated, so you can have them in your operatories. We also have brochures for the patients that include information brochures about all the Stella Life products in one. There's also a brochure that has just the probiotics and one for Dentamedica to explain that. So we have all of these marketing materials that you can give to your patients, handouts, and also reference materials that you can have in your office, which at this point we have like 3 or 4 different charts that you can use for education and to know what's best to use.
Thanks, Liz. It looks like we have one more question that came in. It says, can we still get good benefit if we just use the Stella Life rinse after surgery, like implants or bone grafts with extractions?
You absolutely are best off using the Stella Life rinse rather than, using the harsh chemicals that really cause this dysbiosis and burn and have staining and other side effects. So yes, you're going to get accelerated fibroblast growth and safe disinfection. But again, we need to look beyond just the mouth for healing. We are going to be giving them a lot of benefits with our rinse. But again, because people are stressed, their immune systems are challenged, people are not generally nutritionally sound. I mean, you can just look around you and you can see how many people are really having issues, with their overall health. And all of us have family members that have these issues. So they're not going to heal as quickly or as well. And we really increase the risk of complications if they're deficient in vitamin D for any kinds of surgeries, as well as even with soft tissue procedures such as scaling and root planing. If our patients are deficient in these vitamins and minerals, they're not going to heal well and they're not going to stay healthy. And with the probiotics as well, as we understand and what you saw this evening, this during this presentation, is how we have to really build and maintain that balance. So we really need to look at the big picture. And for too long, we've been focusing just on this, and now we understand that this microbiome is going to affect the microbiome of our brain as P. gingivalis has crossed the blood-brain barrier, causes deposition of the amyloid plaques on the brain, which become the brain tangles. And these are one of the leading causes of dementia and Alzheimer's. So again, we're all connected. And the more you smile, the longer you live. Some studies have shown that. So keeping our patients healthy, getting them beautiful dentistry so that they do smile a lot. I think putting all these things together, we're going to get better outcomes and have better relationships with our patients.
Great. Well, thank you so much, Liz. This was such a great presentation and appreciate everyone's engagement. You're going to be seeing a poll pop up here. We'd love your feedback. And also in the meantime, in the chat, we've put some links. So these are really useful links to the research that Liz covered and beyond. Also for our Stella Life ebook, really is an exhaustive resource that covers not only all of the products, but the different applications in addition to the research. And then lastly, there you'll see a link to our Trustpilot link. Those are real reviews from not only patients, but also other clinicians and teams sharing their honest and unfiltered feedback on the Stella Life products. So that would be a great resource for you to take advantage of. And lastly, as Liz mentioned, for attending this presentation, we'd love to send you some complimentary products. So as next step, you'll see Liz's email in the chat. Go ahead and send us an email, let her know that you attended this presentation and provide your mailing address so we can make sure that we get these products that were covered in this presentation over to you and you can try it firsthand. And then if there are any other questions, please feel free to unmute. This is meant to be a conversation. If you have any questions or even tailored questions, we're happy to answer them. Liz, any last remarks or anything to wrap this up?
I just really want to thank everybody for taking the time today to learn about what we can do to really elevate our patients' health and our practices. Please reach out to contact us. We'd love to help you learn more. As Rachel mentioned, you can email me. You can also call me or text me. That's my direct line because I'm here to help you. And so again, together we can improve lives. That's what we're here to do. So thank you all so much.